There we're there. So this morning we were challenged to think about the future of work and the need for Australian workplaces and Australia to be able to innovate in order to achieve. But unless we get workplace design and work design right, our capacity to innovate and achieve will not be met. We need organisations that are fit for purpose and fit for the future. And to do that, to meet the challenges of of the changing nature of work, where we work in different ways, in different locations, we need good work design. So one of the first things I want to say is what are we talking about when we talk about good work? Good work enhances our capacity and our organisations in which we work, capacity to innovate and to collaborate and to achieve. It goes beyond just meeting the duty of care to provide physically and psychologically safe work, and goes to creating highly functioning, positive organisational cultures that engage us and motivate us to spend our discretionary effort. And you might find me coming back to that. As was mentioned, my PhD thesis looked at workload, and one of the issues that workload is directly related to performance and stress. We want our employees to spend their discretionary effort on in the workplace. Other way. Poorly designed and managed work creates physical and psychological risks, stress and fatigue. And you might wonder why I'm putting up physical risks when I'm talking about psychological health and safety. One of the important things for us to remember is that psychological risks don't operate in isolation. Inappropriate and poorly designed plant and equipment create cognitive demands and physical demands which lead to stress and fatigue. And I just want you all to think for a moment about IT systems as an example. Increasingly in our work, we actually have high human-machine interfaces, and the demands of working with that equipment can be extremely physically and psychologically stressful, particularly when they don't work. Prolonged and/or severe stress exposure really matters. It erodes our capacity to work. It erodes our emotional reserves and our stress tolerance. We can all think of circumstances in our own professional lives where under stress we become short-tempered, we perhaps behave in ways that are quite uncharacteristic to ourselves. And we certainly don't, as we were told to do this morning, have the capacity to coach and mentor others who are learning. Importantly, it increases our musculoskeletal tension, and some of the strongest predictors for MSD disorders are, in fact, the psychosocial working environment. Importantly, it impairs our memory and impairs our decision-making. It impairs our situational awareness, and we all know when that is impaired, the potential for slips, lapses and mistakes, which can lead to tragic consequences like falls from heights, increase. So that those judgments and those errors in and impaired decision-making have threats to us and our organisations. They result in ongoing poor performance will indeed threaten our own organisation's viability and our job security. So what is good work design? Some of the sessions today have touched on this. And at its essence, good work design changes the job content, the what people do. And it's the organising of the tasks and activities that people do on a day-to-day basis or over the month or over the year, the relationships that people have and the responsibilities of the job role or the set of job roles. And it changes the systems of work, the way the organisation and task processes and procedures are organised. This morning, Ms Diane Smith-Gander referred to the SafeWork Australia Good Design Handbook, and I just wanted to draw your attention to this. It's a really useful document for those of you that are unfamiliar with the concepts of work design, because good psychological health and safety has at its heart good work design. So go to that document. It's a great resource. It's very easy. In fact, you're going to read it and say, this is all common sense. And that's right, because it is. Because one of the demystifying processes that we need to do when we go back to workplaces and say is that creating psychologically healthy and safe workplaces is not as complicated as people sometimes propose it is. So now, we've touched on some of the data earlier in the day, and this is a brand new infographic out of SafeWork Australia that was only provided this week that reflects some of the most recent data. So why do we care? Because very large numbers of people who are exposed to prolonged and severe stress go on to have work-related psychological injuries, and those include anxiety and depression, exposure to post-traumatic stress, and so forth. So some of the data out of SafeWork Australia shows that a very significant proportion, 10% of those, are a result of exposure to occupational violence, and 20% to harassment and bullying, a very worrying statistic, and over 21% work pressure. I want to actually unpack work pressure a little bit for you. One of the things I'd say about the data is that it only tells part of the story, is that usually people will actually have multiple causes for their anxiety and depression. And so the data gives you a high-level insight into the principal cause that's reflected in the data, but doesn't give you great depth. You'll get that by doing surveys in your own workplaces. So Jennifer also touched on some of this morning, the very large numbers of workers who are experiencing mental disorders. One of the things I just wanted to draw your attention to, that those of you who are tracking this might notice, is the language. So far I've used stress, mental disorders. You will have heard people talk about mental health conditions or poor mental health. And there's a range of terminology that's used in this space, but for our purposes today, we're using work-related, and that's an important distinction because we're not talking about non-work-related here. Work-related psychological health and safety, and the reason we use that term is that's actually what's compensated. You can see the occupational groups that are most at risk. So when we dig down into the National Workers' Compensation data, 92% of this is attributed to mental stress. So what do we mean by that? So that's stress that's actually driven by work pressure, having too much to do in too little time, and I'm going to talk about some of those psychosocial hazards in a moment. Exposure to harassment and bullying, and occupational violence. I think it's interesting and salutary for us to take a moment to think about what work pressure includes, and it's a grab bag of very important issues that if you do surveys within your organisation, you can unpack and get a bit of granularity about it. So it's around having backlogs and deadlines. And I was just sitting in on the last presentation that was talking about organisational restructures. We know, those of you, all organisations do organisational restructures, but how they're managed and how often they are really important potential risk factors. People do have organisational change fatigue, and actually ensuring that your staff are ready and prepared for change and understand, and the reasons are transparent, can do a lot to actually mitigate the stress and anxiety people feel during organisational restructures. They can be done well. Interpersonal conflicts are often the reason why psychological health and safety issues come to our attention, but I would argue that even in bullying and violence, it's the when you dig down and you look at the antecedents of that, they're very often poor work design which drive that, and they're actually reflected in poor behaviour because people are beginning to fail to cope. So 1 in 3 and 1 in 5 men experience work-related psychological injuries, and the gender issues I think we can all think about in terms of perhaps attributing to women's roles in occupations that are more female-dominated, like healthcare and education. It's really disturbing that over a third of Australians report being yelled at or sworn at work, despite, and many of us have worked in the public sector, and I know Comcare's customers also are in the private sector. I bet none of you have an organisation where there isn't a code of conduct and value systems that say this is unacceptable. I'm not going to go through this. This is really in your resources. So one of the things I wanted to do is to draw your attention to the officer's due diligence requirements. This is a powerful tool for those of you who are advocating that your officers within your organisations attend to psychological health and safety. One of the things that sometimes we notice is that people think that somehow this only refers to physical health and safety. So what I've done today is actually insert the word psychological health and safety. The same duties apply whether it's physical or psychological hazards and risks. Your officers in your organisations must keep up to date with knowledge around work health and safety matters, and I'm going to refer to the SafeWork Australia guide, which was published in June. That begins to show that there's that if it were tested, there is evidence out there of a state of knowledge that they should be aware of. And certainly Comcare and SafeWork Australia have been working extremely hard to make sure that people are aware that those documents are out there. They must understand the nature of their organisations and the risks associated with their operations and foresee those ones that are reasonably foreseeable. So if you're going to undergo an organisational change or a restructure, or there's a peak workload coming up, all of those things should be having a line of sight for management. Those officers need to ensure that the resources and processes are made available and that they're actually getting the information they need. And of course they're used and verified that that they are actually effective. So SafeWork Australia members have been thinking about this issue for a long time. This isn't a new issue. It's been always out there in workplaces, as we know, but over the last decade, SafeWork Australia's members have increasingly turned their mind to it. And some of the drivers that they heard behind the development of the new guide is that employers were confused. They didn't actually know what the legal requirements were and what was the minimum they actually needed to do versus better practice. They weren't entirely sure how to identify psychosocial hazards and simple ways to assess the risks. They certainly were very confused about the level and the most effective control measures and how they could support recovery and return to work. And we were also hearing, while I was at SafeWork Australia, and I know they're still hearing this, that people were somewhat confused about where workplace mental health promotion fits within the scheme. And the answer is it's a highly desirable thing to do, but first you must meet your duty of care. So in answering that, the SafeWork Australia members spent over 18 months developing the new national guide. It replaced some fact sheets that had been on the website for 5 years earlier. So again, this is not a new space. All of the regulators, Comcare particularly, have vast amounts of information on job stress they've had around for at least a decade. But as we've progressively improved our understanding, there was a need to put it into national guidance. So this document was endorsed by all SafeWork Australia members, including the social partners. So its goal is to provide clear, authoritative advice to employers, PCBUs and employers about what they must do. So if you like, this is the minimum. We would, and SafeWork Australia members would, encourage organisations to absolutely go beyond this, but this is the minimum. If you want to take a document to your leaders and say, to help clear up the confusion, take this and say, well, this is the very least you should do, then go and look at what else you should do to go further. SafeWork Australia members were listening to their stakeholders and heard that in real workplaces, people don't separate work health and safety from workers' compensation, actually think of it all as a continuum. And yet a lot of SafeWork Australia's historical documents, in fact all of them except this one, had separated out work health and safety and workers' compensation. The members said, we want an integrated document. This means by necessity the National Guide is quite long, but they don't make any apologies for this. What they've done is quite innovative. So we're going to actually provide a systematic, integrated approach where your organisations can look and say, what are all of the elements in terms of preventing harm, of intervening early and reporting recovery that you must do, either as a PCBU or if we're talking about workers' compensation as employers, to meet your duties under care under both work health and safety and workers' compensation legislation. So it's quite a nice approach. Look, there are other models that use different languages like promote, prevent, whatever. They're all basically the same. So you don't need to get tense about this model, SafeWork Australia's model versus something else that somebody else produces. So long as the elements are there to first of all prevent and then move on, if you fail to prevent adequately, to intervene early and support those who have been harmed. So there were some clear messages that SafeWork members wanted out there. They wanted to be very clear that exactly the same risk management approaches apply for psychosocial issues as for physical. And SafeWork Australia had been working tirelessly behind the scenes at refreshing the risk management code of practice. So this document reflects the new risk management code of practice, and it was no accident that members lined those two up. And they also say, look, one of the big frustrations for the work health and safety regulators is that often they see people get overly bound up in actually doing the paperwork and the risk assessments, and when actually a lot of the solutions are already known. If you've identified the hazards and you know what the controls are, you don't have to necessarily assess. You can go straight to implementing effective controls, but you must check then that they've been effective. So if you know that high workload is an issue, if you know that there's role conflict is an issue, then deal with those straight away and then chip away at the other sorts of issues. So don't wait, you can get on. Of course, having an assessment process allows you to weigh up the issues as well. So now what I want to do is to go through a quick listing of the common psychosocial hazards. Now, one of the points I want to make for you is that if you look at these systematically and try and identify them in your organisation and address them, you will also help reduce your musculoskeletal risks, and you will also help reduce your risks of traumatic injuries, because psychosocial factors underpin everything that we do. If the time pressure is too high, not only will people be stressed, they may make an error and fall from heights. So the first thing to do is to think about the general work demands, the workloads. And it's important to say that can be too high or too low. We know it's actually really quite stressful for people to be underutilised. We like to do work and be engaged and make a contribution. It's really stressful if we're bored and we're not using our skills. But alternatively, being too high for too long and too often is also stressful. I'd like you to actually, when you go back, think about the demands in terms of thinking about the cognitive demands, the emotional and the biomechanical demands. So one of the challenges I think that we have in modern workplaces is, and it was talked about this morning, is increasingly we're knowledge workers. We're doing cognitive work. How much cognitive work are we doing? And we actually need to think whether we have the skill sets to do that, but also how that work is designed. We need to very seriously think about time pressure, both the pace, how fast we have to do things, as well as the total working hours. So some workplaces you may not have people working very long hours, but they might be working very intensely while they're there, or you might have both. And the working hours issue also you need to turn your mind to shift work and what's occurring there. So low skill utilisation is a huge source of stress. It's de-skilling and demotivating. And earlier on I referred to discretionary effort. If people are not using their skills, they will invest less discretionary effort and put less effort into work. High responsibility without appropriate control. People do like responsibility, but they don't want too much, and they certainly don't want it when they don't have control. So you might like to think of examples where you've been told to deliver something by a certain period, but you're not getting the information you need when you're required, or maybe the resources. So if you don't have the control matched with the responsibility, it's a source of stress. Low job control has been known for 4 decades to be a source of psychological stress and poor health. And that means it can be everything from having the poor control over how you work and your shift choice to more fine areas. I touched on frequent and poorly managed organisational change. We live in a changing world. We expect organisational change, but people have varying capacities to cope with it, and transparent provision of information can remove a lot of the fear and a lot of the concern. Poor working relationships and conflicts at work, we all know, and we could see certainly from that bullying and occupational violence data, that they're a direct source of stress. When we talk about support, I'd like, often people go straight to emotional support, and look, emotional support is great and we all want it, but it's also really important that we think about the other kinds of support. If you have an IT system that is not working, if you don't have the right equipment at the right time, so it's instrumental support, and you don't have the right information when you need it, both those are significant sources of stress. Look, we all like being appreciated at work, but they won't mitigate the stress if you don't have the right information and the right equipment to do it. The stress associated with low recognition has been well recognised, but one of the things I think that's important to realise is that we usually look at effort-reward imbalance against our peers. So while we might, grumble over barbecues about the difference between perhaps Telstra's CEO's salary and our own, typically people really just want to see equity amongst their peers. Low organisational justice, particularly in relation to complaints, is a very serious stressor, as is poor physical working conditions. So one of the other things that SafeWork Australia members want to very clearly put into this guide was to reinforce that the hierarchy of control is applicable. Sometimes we used to get asked to create a new one. And what members said, that, so you'll recall this from your risk management code, that it's about the 4 simple stages of first elimination. And what we mean by elimination is eliminating the hazard or risk altogether. So that might be things from actually removing that task altogether by that organisation. That can be sometimes quite challenging, but it actually may be more appropriate to outsource a function to another organisation that is actually designed to deliver that service specifically, rather than try and do it with inadequate staff and inadequate facilities in your own organisation. So your first task is to systematically look at all those psychosocial hazards in isolation and see if you can eliminate it. The second area of the that's usually called substitution engineering controls is just think of that as work redesign. So in the guide, what we say is substitution. Just think of it as substituting a hazardous way of working with a less hazardous way of working. So can you do it differently? Can you make it safer? Can you increase the number of staff? Can you increase the role clarity? Decrease the time pressure? There are a range of administrative controls that you then can think of, and some of those might be job rotation. So, for example, if I think about staff in Centrelink who are being exposed to aggressive clients, that's the nature of their work. You can't eliminate those aggressive clients, but you can actually, through job rotation, reduce the exposure of those staff to the frequency of exposure and then personal protective equipment. And in the guide, we had some examples, and you might think, what's personal protective equipment got to do with psychological health and safety? But we can think about nurses working alone and remote alarms, or even, in fact, how the failure to provide adequate PPE when you're doing physically dangerous work can actually be a source of stress. So one of the things that SafeWork members want to remind you of, which is perhaps a step up from the risk management framework, is that you're going to actually have to use a combination of controls. It's not like you can use one. You're going to, first of all, of course, need to look at elimination, and then you're going to need to look at a whole range of job redesign issues, and administrative controls and PPE. So one solution will not fit all. You're actually going to need to, because for some psychosocial hazards, there may only be one control that you can do. One of the challenges that I'd like you to take away, though, is that typically in health and safety, we've historically tended to think about hazards in isolation. We might think about hazard as manual tasks, and then we'll go over here and talk about chemical exposures and vibration and maybe psychosocial. Yeah, sure, you've got to do those, but then you're going to have to put them all together, because that all of those hazards actually interact. So you're going to have to look at each hazard in isolation, then in combination, and then the hazards for that task and for that job. And I would urge you for teams of workers. That sounds like a big ask, but you're actually going to find that a lot of these solutions are similar. So that's one of the challenges for the future. One of the issues is to be mindful about what so far as reasonably practical means in this space. So one of our challenges for our officers in taking responsibility for designing work and work design is it's only as good as their state of knowledge of those making the decisions. So one of the things for you as workplace health and safety advocates is to help them improve their state of knowledge. But we need to also be aware that a PCBU has sort of certain biases, and they need to actually be made aware of those, and where they have inadequate data and knowledge about issues. So one of the things you can do is take back the information from courses like conferences like this and show them what they reasonably ought to know in this circumstance. Look, and typically what we find is not just for psychosocial hazards, but also you would know for manual tasks and those sorts of things, is that there's a default position to go into lower order controls. And we advocate eliminate and substitution in engineering, but it's really hard to get leaders to look up. So we need to actually say, look, EAP is not it is useful, but it is not the solution here. You need to go and look at the design of your work and the design of your management systems. And one of the other challenges for us is actually to think that often in terms of what's grossly disproportionate to the risk, when people are thinking about control solutions, that we find there's a large level of error in how expensive people think things are. One of the things that you can do, there's some great pieces of work by Professor Sharon O'Neill on the SafeWork Australia website on return on investment and business cases for health and safety. But it's really important that we encourage people to look at the costs that they can save and the benefits to the organisation of designing work so people don't make errors. So it's not just the costs averted in terms of preventing physical harm and psychological harm and workers' compensation costs. It's how much more efficient and motivated and how much that people will be prepared to spend their discretionary effort if you design work well in the first place. So there's some other great resources on the SafeWork Australia website to unpack this in, and today's discussion wasn't actually about giving you a blow-by-blow issue, but just to draw your attention to some of the resources. So Super Friends, who some of you might have gone to their presentation earlier in the day, worked with SafeWork Australia to actually produce some best practice approaches. Now, whilst this was designed for workers' compensation authorities, insurers and claimants managers, and some of you may well fit that space in this audience. It's got some great practical evidence-based advice about early intervention and return to work in there. It's a great resource to go and look at. So I wanted to kind of unpack some ways about thinking about prevention and corrective action. So I've adapted something from one of my favourite researchers, Professor Tuckey from the University of South Australia. So I want you to think about it in terms of an organisational focus and a system design focus and an individual focus, a prevention and a corrective. And in fact, to do that, prevent, early intervene and recover, you are going to need to do all of these. Some of these are clearly the PCBU's and employers' responsibility, and some of them are the workers. It is a shared responsibility, but those with control have more responsibility. So the first things I want to talk about is on the prevention side. So we all know the evidence that it's far better to invest energy in prevention rather than picking up the pieces afterwards. So like physical hazards, first of all, identify your hazards and risks. It's really important that you consult the workers and the health and safety reps to implement changes. In health and safety, you'll often hear it's the workers real versus the workers imagined. The workers will know what the issues are. They are your first stop for going to help you identify the problems, and they typically have really good suggestions on how to fix them. So consult your workers, in fact, a duty under health and safety law, and it makes great sense. So when you're thinking about your workloads and your organisational change strategies, make sure you consult those people. You need to review and monitor the impact of those psychosocial controls that you're putting in place, and of course the leaders need to show leadership and commitment, and part of that will be ensuring that adequate resources are invested in this space to develop and use the policies and train the workers. And workers, of course, have duties to participate in the risk assessments and implement the controls that are asked for, and to comply with policies and procedures. So on the corrective side of the equation, employers need to actively manage organisational change. They need to train their leaders and their managers and their supervisors in workload management, in conflict and stress management. They need to set up reporting mechanisms and investigate concerns, intervene early when staff are distressed, and keep in contact with workers whilst they're off work. And some of the work by SafeWork Australia and Mary Wyatt has shown that that returns great investment if you stay in contact with your workers. And workers have responsibilities as well to follow and comply with their return to work matters. I wanted to remind you about the Australian Work Health and Safety Strategy 2012 to 22, I should know, I was part of it. It was reviewed recently and found to be still fit for purpose. What's important about this is that more than 5 years ago, SafeWork Australia members were saying mental disorders are a national priority. It remains in there. Work design and good management of plant and equipment, leadership and culture were in that strategy. They remain just as valid 5 years later. So what's happening in the near future? SafeWork Australia is currently, with the help of Mari Boland, reviewing the model legislation, and there's some very interesting insights from the public consultation that's up on the website, so go and have a look, which says unsurprisingly that psychological health and safety is a huge community issue, and there are calls to look at this area in greater granularity in the future, and I'm sure SafeWork Australia will do that. Every health and safety regulator across Australia, but since we're in Victoria, I'll draw attention to Victoria, New South Wales and Comcare are investing heavily in good workplace mental health. There are some great initiatives going on to support workplace initiatives in mental health, and there are tens of millions of dollars that are backing up their commitment. the heads of workplace safety authorities are very mindful that one of the complaints that they heard was inconsistent applications of the law and perhaps lack of inspector capability in this space. Although it's not public facing, I wanted to reassure you of how much work the health and safety authorities are doing behind the scenes to skill up a new inspectorate that are fit for the challenges of the workplaces of the future. There's huge investments in psychological inspectors going on around Australia, including in Comcare, and they're building a whole suite of training and toolkits for the inspectors. And I might note that this new guide is part of the tools that the inspectors will be using. So again, go back to your managers and say, should an inspector care to visit, one of the things that will be in their toolkit is that national guide that they will be expecting us to comply with. So now what I wanted to do is, enough talking, is to open it up to you and let's have a talk about some of the psychological health and safety challenges in your workplaces and how they might, and how work design might operate. And this is your chance to actually talk to me about some of the challenges. If I don't have the answers, I'll tell you. But let's start with the issue of organisational change. Whose organisation is going through change? Only that many. Okay, so this is meant to be slightly interactive, so I'm going to ask you, the lovely lady in the row back there with the nice long hair, what your organisation's doing to manage organisational change, being mindful of your workers' psychological health and safety.
Look, I'm from John Holland.
All right, yep.
Probably about, I reckon every 6 months for the last 4 years, we've had an org restructure with no support at all. New people come in, new rules are set, and we're being told pretty much change is the new thing. Keep up with it, and that's essentially what we do. There's not a lot of support and a lot of structure.
Okay, so I would argue that that's a reasonably foreseeable risk, and it sort of ticks a whole lot of the boxes in the guide in terms of psychosocial hazards that are also reasonably foreseeable. So one of the things that, has anybody got some suggestions on how they're dealing with organisational change positively in their workplaces?
Rachel from NBN. Our structure changes almost 6 monthly at the moment, heading towards an operate and maintain from a build. And what a lot of the executives are doing are making sure that their managers and flowing down are actually communicating the changes as soon as they can, looking towards what's going to be there in the future.
And that's great, because one of the things we know that actually will reduce stress is certainty. So people can handle bad news, but they need to know. So what they don't like is surprises. So the more information you can provide them, particularly with the information about why those decisions are being made. People won't necessarily agree why those decisions are being made, but that helps alleviate a lot of anxiety. So transparency around that's really important. Anybody else got some suggestions on managing organisational change? I'm going to ask my colleague over there, Mr Jones, who's been thinking a lot about organisational change and looking at around about what are some advice that you have for better managing organisational change and the fallout from that.
Well, I think, thanks for dumping me in.
Yeah, that's all
Peta,
right,
thanks.
mate, anytime.
Look, I think one of the things that we struggle with is, and the two questions brought it up, is that the certainty that you talk about that reduces stress, perhaps the current status is that there is no certainty, that you're in a constant state of flux. I know it used to be restructure after restructure after restructure. New CEO comes in, another restructure. And that was never, it was never good. It's not good work design. But I'd be interested to know how many workplaces are starting to operate without any certainty. You know, without any sort of, where we used to have the structure of full-time employees, now we don't have that as the dominant core of our workplace. And that's one of the things that strikes me from the guidance, is that the guidance is based on assumptions of a structure that might be out of date in a lot of our workplaces. And so I'd throw it open to sort of, you know, how many people are in this structural uncertainty that just increases to a level of psychological distress that is the norm.
Yep, yep.
I work for the Department of Human Services. We're in constant change, and I think it's the kind of, in a way, the opposite. We've gotten to a stage where we kind of just go with the flow and just do as we're told, you know, because it's just going to change again in another couple of weeks or another couple of months, and so it's almost become blasé. The change.
I think it's change inoculated.
Yeah, it's and you were saying before about, you know, change fatigue, and it's almost like that. We're so fatigued that we just can't be bothered anymore.
But then there's the issue of people's willingness to spend discretionary effort and their ability to innovate.
Yeah.
So the theme of this conference is to innovate.
And it's almost like that, because, you know, there's no point in even putting up new ideas, because in a couple of months we'll probably have a new minister. They'll want to change the whole way it's structured all over again.
Yep.
And start from scratch, because we've had, I think, 9 in the last 18 months.
I won't make any comment.
Yeah.
Yeah. So, I mean, I think one of the things...
And we're a quarter of public service.
The APS is very aware, if you look at their surveys, is the... and I know we've got private sector organisations here and they deal with change all the time as well, is that organisational change is a source of stress, but having a change management plan that's transparent and communicated and rational is really important.
I think the one good thing that we've come out of it, a lot of it came from the staff survey from last year's census, was that the SES weren't very visible, and they've really focused. Our new secretary is very people-focused, and for the first time in the last decade, you know, the SES are actually visible. They are actually communicating with us, but not only that, they're allowing for us to actually have some input back up the line. So it's the first time in a decade that I've actually felt like we're included in some of the decision-making, but again, how long is it going to last?
I can tell I'm being wound up because you all need to go down to a plenary session. But have a look at the guide. There's some great resources on Comcare's websites on unpacking control options, and some fantastic case studies, including from the private sector.
Please join me.